Once upon a time, in the breathtaking peaks of the Himalayas, a group of adventurous climbers embarked on a journey to conquer the tallest mountain in the world. Among them was Sarah, a seasoned mountaineer with dreams of reaching the summit and standing at the top of the world. As climbers ascended higher and higher, let's say above 2000 to 2500 meters, the air grew thinner and the effects of high altitude began to take their toll. Some members of the group experienced symptoms of mountain sickness, or as we call it, high altitude illness. They showed signs of nausea, headache, and dizziness. But Sarah ignored these warning signs and kept going up, pushing her body to her limits. Hello everyone and welcome back to PharmEd Academy channel. Today we are diving into a fascinating world of high altitude sickness, also known as mountain sickness. In this video we'll explore the causes of high altitude sickness, the different forms it can take, and most importantly, how to treat and prevent it. From understanding the science behind altitude-related ailments and practical tips for acclimatization. Join me as we embark on this educational journey filled with storytelling and animation, making complex medical topics easy to grasp. If you're ready to conquer the mountains without fear of altitude sickness, hit that like button and subscribe to my channel for more insightful content. Let's get started. As you ascend above sea level, something extraordinary happens. The air around you begins to thin out, leading to a decrease in atmospheric pressure. But what does this mean for your body? Well, imagine this. At the peak of Mount Everest, oxygen levels can plummet to as low as 6%, a stark contrast to the 21% found at sea level. But why does this matter? Stay with me as we unravel the mystery. So in our story, Sarah and her friends are faced with a challenge. They were getting less oxygen than their bodies were used to. Less oxygen means less fuel for our cells, leading to a condition known as tissue hypoxia. But fear not, our bodies have a remarkable ability to adapt. This process called acclimatization kicks into gear to ensure our tissues receive enough oxygen to function optimally. But here's where things get interesting. Unfortunately, Sarah and her friends didn't allow their bodies enough time to adjust. Their rapid ascent prevented proper acclimatization, leaving them exposed to the effects of altitude sickness. But you may ask, what are these effects? Acute mountain sickness, or AMS, is not just a headache or feeling tired. It's your body's way of telling you something isn't right. Headache, fatigue, dizziness, nausea and vomiting, peripheral edema, sleep problems. These are just a few of the warning signs that something serious might be happening. And they usually show up within 4 to 12 hours of ascending above 2000 meters. So Sarah and her team kept ascending and approached the treacherous heights of the mountain. And then something terrible happened. Sarah's friend Alex suddenly collapsed, gasping for breath as his lungs struggled to cope with the decreased oxygen levels. What do you think happened to Alex? It was high-altitude pulmonary edema, or HAPE. High-altitude pulmonary edema is like an unexpected twist in the plot, a non-cardiogenic pulmonary edema that strikes swiftly after rapid ascent, usually above 4,500 meters. Your lungs, unable to cope with the sudden change in altitude, become flooded with fluid, making each breath a struggle. You may wonder how HAPE happened. Let's look at it this way. Imagine your body as a busy city, each organ system a vital neighborhood working in harmony. But when the oxygen supply dwindles, it's like the city lights dimming, signaling trouble ahead. Low oxygen supply makes it difficult for tissues to get their oxygen, just like when the city lights are down. Cars can't get to their homes and get stuck in the narrow streets of their city. This represents the hypoxic pulmonary vasoconstriction. This traffic spreads through the city, leading to a gridlock, which shows pulmonary hypertension. As pressure mounts, inflammatory responses ignite, setting off alarms throughout the city. Suddenly, calm alveolar spaces are flooded, akin to rapid city flooding after heavy rainfall. Despite attempts to clear the fluid, inflammation disrupts lung function, leading to fluid accumulation, just like a city with blocked drainage. Here are the steps leading to pulmonary edema as we covered in our city metaphor. Symptoms are cough, shortness of breath, chest tightness, Cyanosis, which is the medical term for when your tissues like skin and nails turn blue due to lack of oxygen. Tachypnea, or higher rate of breath per minute, and tachycardia, or heart rate above normal. In a race against time, Sarah and the rest of the team rallied together to administer life-saving treatment and evacuate Alex to lower altitudes. Along the way, they encountered other climbers helping one of their friends who had trouble walking and couldn't keep his balance, and finally fainted. This man was suffering from another severe form of AMS, which is high-altitude cerebral edema. HACE mostly happens due to increased cerebral vascular permeability and cerebral blood inflow, which lead to high intravascular pressure and cerebral edema. Much like acute mountain sickness, high-altitude cerebral edema manifests with familiar symptoms such as headache and nausea. However, it brings along additional companions like loss of consciousness, ataxia or lack of coordination in muscle movement, leading to unsteady or clumsy movements, visual impairment, and even disruption in bladder and bowel function. As Sarah came back to continue her ascent, Sarah herself began to feel the effects of altitude sickness creeping in. She experienced a splitting headache, difficulty breathing, and moments of confusion. Recognizing the symptoms of high-altitude cerebral edema, she knew that descending to lower altitudes was crucial for her survival. As she was coming down, she started to think about Alex and that other hiker and what would happen to them. This makes us talk about the treatment. For AMS, stop ascending until symptoms resolve and descend if symptoms do not improve or get worsened. Symptomatic treatments like ibuprofen and antiemetics like ondansetron can be helpful. In moderate to severe cases, oxygen therapy with the target O2 saturation of 90% and pharmacologic therapy are the way to go. Acetazolamide 250 mg every 12 hours and dexamethasone 4 mg every 6 hours are our choices, with acetazolamide being the preferred option. In cases of HAPE and HACE, descending immediately and oxygen therapy are very important. Dexamethasone is a rescue medication for these patients, and some patients may need hyperbaric oxygen therapy, which is a treatment involving the inhalation of 100% oxygen in a pressurized room or chamber. Other medications like nifedipine and PDE5 inhibitors like sildenafil and tadalafil may be used in high-altitude pulmonary edema patients, depending on the situation. Sarah learned a lot throughout this experience. Acclimatization, hydration, and recognizing the signs of mountain sickness are very important. But there was one other thing on her mind. Is there a way to prevent mountain sickness? Well, a few things can be very helpful to prevent AMS. First of all, as we learned in this story, ascending slowly, known as a staged ascent, is the first step. Having oxygen during sleep is another effective method. Pharmacologically, acetazolamide is the first choice for prevention. Acetazolamide is typically taken on the day before ascending and continues for 48 hours. It can be taken further if you plan to ascend more. Some experts suggest taking acetazolamide once at bedtime after the first few days. It also helps with sleep. The most common side effect is peripheral paresthesia. Dexamethasone is our second choice for preventing mountain sickness. Dexamethasone, unlike acetazolamide, doesn't help with acclimatization. In general, dexamethasone is reserved for treatment and acetazolamide is primarily used for prevention. Thanks for watching this video. I hope you enjoyed this video and learned something new today. If you enjoyed this video, please like, share and subscribe to my channel for more content like this. See you in the next video.